I'm Terry Hancharick, Chair of the Adult Issues Committee of the Delaware Developmental Disabilities Council. Did you know that according to the National Down Syndrome Society, about 30% of people with Down syndrome who are in their 50s have Alzheimer's? In this video, Dr. Stevens and Bartoshesky of the Down Syndrome Clinic at Christiana Care Health System share their thoughts on the correlation between Down syndrome and Alzheimer's. For individual medical advice, please consult your medical professional.
Down syndrome is a condition related to a variation in number of chromosomes. Usually we have about 46 chromosomes, 23 from mom at conception, 23 from dad. And the chromosomes are paired and they're numbered 1 through 22, and then 2 chromosomes are called sex chromosomes, an X and a Y. And Down syndrome is a condition that occurs when there are 3 copies of chromosome number 21 compared to the usual 2 copies.
So Down syndrome is a condition due to a duplication of the 21st chromosome. There's some common medical conditions associated with Down syndrome, like an increased risk of congenital heart disease and of thyroid disease. And then in most patients with Down syndrome, there is some degree of intellectual disability.
Not totally clear why that's the case. There are lots of theories, but no one is completely sure. One of the main theories is that there's a gene on the 21st chromosome. Most people have 2 copies of that gene. People with Down syndrome have 3 copies. And that gene is associated with the production of a chemical known as amyloid, which can then deposit itself into parts of the nervous system. And that may be why people with Down syndrome have more higher frequency of Alzheimer's.
We know in the general population, certain things make a difference and certain factors are protective, like degree of education and staying involved and keeping the mind active. So we think all of those things are also important in adults with Down syndrome, but it's also important to make sure that we're recognizing common medical conditions or mental health issues in someone with Down syndrome early to make a difference and perhaps change the trajectory for that person.
The most common is probably some short-term memory loss. Along with that, there may be changes in balance, there may be changes in selecting a proper word, there may be some observations of the language being somewhat more confused for the person with developing Alzheimer's. So it's a slow progress of things, not a single bolt of lightning that occurs.
So I think it's really important to make sure that something else isn't going on that is treatable, because unfortunately right now our treatments for Alzheimer's are not very effective. So, and some of the conditions that we see in our patients really are. So making sure that hearing screens and vision screens are up to date and correcting those abnormalities, making sure there's not vitamin deficiencies like a low B12 level, making sure that we diagnose and treat diabetes and sleep apnea early, and then finding the right level of activity that's appropriate for that person at that stage of their life. So some people have talked, although we think working and being a part of the community are really important for folks with Down syndrome, perhaps sometimes it's important to think about scaling back so people have the right opportunities to be successful. I think also, while it's more difficult to diagnose depression and anxiety or even obsessive compulsive disorder in people with Down syndrome, it's important to make those diagnoses and treat them appropriately, because that can change the quality of life and the function of someone with Down syndrome.
Research in several areas. One is just behavior, and research looking at how people with Down syndrome learn, and how their learning skills progress, and how they can sometimes lose learning skills. More on a somewhat different basis is research around the production of a chemical called amyloid that may be associated with the 21st chromosome. Most people have 2 copies of 21st chromosome. People with Down syndrome have 3. And one of the genes on that chromosome does seem to be correlated with the increased frequency and earlier onset of Alzheimer's. Both areas of research have been productive. As a geneticist, I'm particularly interested in the research around the production of amyloid in the 21st chromosome. If an important factor in Alzheimer's is an extra protein being deposited in certain parts of the nervous system, why not come up with a product that will block that movement of that particular chemical into the nervous system, that's where I think there's a really great hope for interfering with the progression of Alzheimer's.
I think certainly with a greater focus on education and inclusion in young people with Down syndrome and maintaining optimal medical care and ongoing research, the future is very promising.
We would like to thank all of those who participated in this project. For more information, visit decommunityconversations.com.